The virus that causes polio has been found in New York City's wastewater, in another sign that the disease is quietly spreading among unvaccinated people. The discovery of the polio virus in New York City comes shortly after British health authorities reported finding evidence that the virus has spread in London, but no cases were found in people. Meanwhile, the Public Health Agency of Canada began testing wastewater in multiple high-risk communities this week. No cases have been found as of yet, though. The polio virus causes paralytic polio and can lead to permanent paralysis or even death. Well, joining us now to tell us more about polio and the risk it poses to Canadians is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to join you today.
Seems that we're always talking about viruses, Dr. Raut. Today we're talking about the polio virus. So let's start with an overview of what exactly polio is and how the virus affects the human body.
Right. Well, I never thought in my medical career polio would make the news again, but here we are. Polio is short for poliomyelitis, which is a very serious contagious disease. It's caused by the polio virus. This virus can attack an infected person's nerve cells in the spinal cord. This can leave muscles permanently weak or damaged, and about 1 in 200 people infected with the virus becomes paralyzed. Thanks to immunization, Canada has been polio-free since 1994. But before that, the polio vaccine was introduced in 1955. Thousands of Canadians were affected. And among those paralyzed, about 5 to 10% died when their breathing muscles became immobilized.
Sounds terrifying, Dr. Raut. Now, what's interesting is that symptoms don't show immediately in those infected with this virus. So what are the first telltale signs of a polio infection?
Right. So you're exactly right. Most people who get infected with polio virus will not have any visible symptoms, but about 1 in 4 will have about flu-like symptoms that include, and stop me if you've heard this before, sore throat, fever, tiredness, nausea, headache, and stomach pains there. These typically last about 2 to 5 days and then go away on their own. A small proportion with the polio virus infection will also develop more serious symptoms like meningitis, which is an infection of the spinal cord or brain, or paralysis, which is the weakness in the arms, legs, or both.
And we talked a lot about droplets when it comes to COVID-19 transmission. How is polio transmitted, Dr. Raut?
Right, so polio is very contagious. The virus lives in an infected person's throat or intestines. It enters the body through the mouth and spreads through contact with the feces of an infected person. But it can also be spread in the air when an infected person coughs or sneezes. An infected person can also spread the polio virus to others right before and about 2 weeks after they've had symptoms there. Now, a vast majority of people who get polio, as we talked about, don't have any symptoms, but these people can still pass the polio virus to others and make them sick.
All right, Dr. Raut. Well, we are talking a lot about vaccinations during the COVID-19 pandemic. Considering that polio was eradicated in Canada by 1994, as you said, how likely are Canadians to already be vaccinated against this polio virus?
Right, that's a great question. And I think it depends on the vaccinations rates that we have now and in the future as well. So a majority of Canadian public has been vaccinated against polio. The latest data we have is from 2017, roughly showing 90% of all toddlers had all 3 required polio shots. But that coverage isn't really uniform across the country. Vaccination rates are below 90% in British Columbia and Manitoba, and close to just about 80% in Nunavut. And so the uptake in specific communities varies significantly. And of course, not to mention all the disruption that COVID-19 school closures have caused, I suspect these numbers have decreased even further now.
All right, Dr. Raut, about a minute left here, but what are the demographics that are most at risk? Are the elderly more at risk than children as it is for COVID-19?
Right. So polio terrified parents around the world for the first half of the 20th century. And that's because children under 5 years of age were the most highest risk of getting polio. However, any person at any age who's not immune can certainly become infected. But when we look at children specifically, even children who seem to fully recover would develop new muscle pain, weakness, and even paralysis as adults 15 to 40 years later. So this was called post-polio syndrome, and that's why we specifically worry about children under 5.
All right, Dr. Raut, a quick 30 seconds left here, but what can Canadians and officials do to stay protected from polio?
I think the most important thing here is immunization. As Canadians, we need to make sure our children are well immunized. And as officials, we have to be prepared for additional vaccine coverage to at-risk communities.
All right, Dr. Raut, always great having you on Forum Daily. Thank you again for your time today.
Thanks so much for having me.
Stay with us. When we come back, we'll be speaking with NDP MP Jenny Kwan to look at how Canada's efforts to help Afghan refugees compares with its efforts with Ukrainian refugees. So stay tuned. We'll be right back after a short break on Forum Daily.